Good morning, everyone. My name is Dr. Pearl Yellow Lumen Healy, the Child and Youth Wellness Specialist with Siksika Mental Health and Wellness. And I thank you all for taking the time to join us for the first session of a Lunch and Learn series that will provide information about funding supports, resource supports, and service provision from various service providers. These are virtual series that will be recorded and later added to the Siksika Health Services resource library. And the purpose of these webinars are to create awareness of what service provision and supports are out there. And there will be a few minutes afterwards for about 15 minutes for questions. That portion of the recording will be stopped at that point. And I would like to introduce today's speakers, Hilda Lamb, Disability Services Supervisor, and Nellie Alcaraz, the caseworker with the Family Support for Children with the Disabilities Program. Thanks for joining us.
Thank you, Pearl.
Thanks, Pearl. So I am honored to open this gathering with the land acknowledgement. Inspired by the 94 recommended calls to action contained in the Truth and Reconciliation Commission of Canada, land acknowledgements are a necessary first step toward honoring the original occupants of the land where we are gathered. They also help us recognize and respect the inherent kinship beliefs of Indigenous people when it comes to the land, especially since those beliefs were restricted for so long. My name is Nellie Alcaraz. I am very grateful to be here, and I am caseworker with Family Support for Children with Disabilities. I acknowledge that I am an uninvited visitor to this land. I am originally from a group of islands now known as the Philippines. And I acknowledge that I owe many of my family's privileges on this land to the First Peoples of Turtle Island, and that my family's presence as settlers have come at the cost of Indigenous people's lives, land, rights, language, and culture. I am grateful for my opportunity to be able to work, live, and build a community under traditional homelands of the Blackfoot Confederacy, the Siksika, Kainai, and Bigani, and other Treaty 7 co-signatories, the Tsuut'ina, the Iyarhinokooda Nations, and the members of Métis Nations Region 3, and those who call Treaty 7 home. I recognize that I am on Indigenous homelands and express my gratitude and appreciation to Indigenous peoples of today and those who came long before us and took care of this land for us and the future generations. This is the first time we will be doing this. I would like to welcome Hilda Lamb to do the introduction to FSCD.
Thank you, Nellie. So we'll try our best today in this Lunch and Learn to provide an overview of FSCD program. Hopefully by this end of this presentation, you guys will gain an understanding of FSCD support, the eligibility guidelines in the FSCD program, some of our services and support, and expectation of services. And at the end, we would like to also provide some of the resources that you are able to access after the presentation. So what is FSCD? So in a nutshell, we are really a family-centered program that helping family with extraordinary needs that are related to their child's disability. We have a lot of support and services that provide for parents in caring and promote their child's development. And we do have some financial assistance really helping meeting some of those extraordinary demands in raising a child with disability. So a lot of the time we want to make sure that we're providing information, referral, and advocacy for families in assessing their needs in their family and the child's needs. So program goals and authority, I'll pass this to Nellie to talk more about the vision of FSCD.
Awesome, thank you, Hilda. Yeah, so the FSCD came because of the act that's called FSCD Act that came into effect in 2004. So before there was the Child Welfare Act. Because of that, the Child Welfare Act the FSCD Act came to provide services. So before, the Child Welfare Act didn't cover the Indigenous children on reserve, but now the FSCD Act covers children everywhere in Alberta, including those who live on the reserve. So it is the first of its kind in Canada, and it has separate legislation for children with disabilities and their families. The purpose is in order for the families to have the support that they need to develop, learn, and be included in activities at home and in their community, and that families have the support and resources required to care for and promote their child's development and participation. So the vision can be accomplished by focusing on what the child can do instead of how it is accomplished, and in making adaptations to support the child's activity and participation. So the principles that guide FSCD, the program adheres to family-centered practice, where families are active partners in the planning and decision-making regarding the support for their child. The FSCD services recognize the uniqueness of each family and respect the cultural and socioeconomic diversity of families. FSCD staff, including us, myself and Hilda, we provide information transparently and assist with the coordination of services at local, regional, and provincial levels. So these are the program outcomes. This is what we hope to achieve, is that children and youth have positive social relationships. Children and youth acquire and use knowledge and skills. They take appropriate action to meet their needs, that families are healthy and well, that families have support systems, families help their children develop and learn, and that communities include children and youth with disabilities, and that youth can successfully transition to adult life.
Thank you, Nellie.
Thanks.
So what is the program eligibility? So when we look at FSCD eligibility, our program can open a file for children under the age of 18. So we have the youngest were newborn at 0 and up to the age of 18. When we look at the guardianship, the guardian must really maintain the full guardian responsibility of the child, regardless whether the child resides in or out of the family's home. And we also look at the residency, and where the child must be a Canadian citizen or a permanent resident when within the meaning of the Immigration and Refugee Protection Act Canada, or ordinarily reside in Alberta. We also have a definition for the disability in the FSCD Act. When we look at the eligibility for disability, is that disability is a chronic, defined as chronic developmental, physical, sensory, mental, or neurological condition or impairment that does not include a condition for which the primary need is for medical care or health services to treat or manage the condition, unless it's chronic condition that significantly limits a child's ability to function in normal daily living. It's a long definition, so I'll give you examples of what we look at. So when we look at that limitation, we are not looking at medical care or health services that are able to treat or manage a condition. So for example, diabetes. Children with diabetes can be met through insulin. Insulin is a medically fragile managing that condition. Kids who have brain cancer, sometimes treatment are often result in a significant impact on a child's ability to function in activities or normal daily living. So when we look at children who are not eligible for our programs, are the ones that are being met through the medical care or health services. And also, we're looking at that result, after that medical care, if there's a significant limitation in their ability to function normal living activities. So right now, the FSCD program is actually transitioning into a centralized application process. It's called the Disability Application Process. So the more acronym, we call it the DAP. The main purpose is really for Albertans and to experience more of a streamlined application process with more of a consistent communication through this process. So when families are looking in applying for FSCD, step one is to really review the FSCD program information around that eligibility. If you think that your child is eligible for the program, the step two is to complete and submit applications through the My Alberta Support portal. And after that, you would forward any further correspondence or inquiries to the FSCD email, centralized email box, which I have it here. And this can be provided to you guys afterwards. This is where the centralized application process, where they review the application. They will have a caseworker that follow up with the families around the eligibility and the next step through the process. So here are some guidelines for the healthcare professional and what to submit. A lot of the time we do receive letters or reports around the child's diagnosis. Also speak about the child's condition or any kind of impairment that might lead to a disability. Often we can also open a file when a child is awaiting for a medical diagnosis. So FSC can open a file up to 2 years when a child actually wait for a medical diagnosis. A lot of the times the reports that we receive will speak more about the daily functioning. It also talked about if it's a long-term or lifelong implication. We want to make sure that there is a date that is identified on the letter and the report as well, as also including the health professional that has that implication on the diagnosis. So sometimes when we look at what not to include is around opinion on the child's eligibility for FSCD, also opinion on services and support, because most of the time, support and services are discussed after an FSCD worker is meeting with the guardian. If a child is diagnosed more than 2 years ago, we just ask to provide any documentation that are available when the original diagnosis was made, and also provide any recent information from the health professional who are providing ongoing or follow-up care for the child. And that can also be part of the intake process. Just a note that the FSCD, we don't ask parents to pay to get any kind of the medical documentation for the process. A lot of the time, doctors will be able to kind of write a letter or speak about that diagnosis. So fees or costs associated with getting any of the documentation are responsible of the applicants. Okay. Services and support. Back to you, Nellie.
Thank you, Hilda. So what do we provide? So our FSCD services are grouped into 2 categories: the family support services and the child-focused services. So the family support services are intended to support families with the extraordinary demands of caring for a child with a disability. And these child-focused services build on family support services and offer supports to help families manage a disability that significantly limits the child's ability to function in normal daily living. And I'll discuss what those means on the next slide. So that's the FSCD services that we have. We provide information, referrals, and funding for a range of services, including individual and family counseling, respite services and aid supports, childcare supports, and out-of-home placements. And assistance with disability-related costs for attending medical appointments, clothing and footwear, and high-related needs such as dental care, medical supplies, ambulance, and prescription drugs, formulas, or diets. We will entertain questions after this presentation if you have if a question pops up in your head, we'll do Q&A after.
Yeah. And just a note that a lot of these services are really based on the assessment of need between the parents and the guardians and the workers. So yeah, these are just kind of some samples of our services that we provide in our program.
Yeah. So what are the limits of those services? FSCD cannot assist with costs, care demands, and decision-making typically associated with raising a child. So a child, if you're the guardian, you have the financial responsibility to provide what typical child requirements are. So the FSCD service will not pay for those, but will pay for disability-related extraordinary needs that I've mentioned. So those are the, in the previous slide. The services that are not included within the FSCD program is transportation to and from any FSCD-funded supports, school or recreational programs, tutoring and education support, services the day the child turns 18. So when an adult child is not covered by FSCD, or an adult, I shouldn't call it a child, an adult. Basic needs, recreational activities, and other services typically provided by guardians, again, and interpreter services. But we can assist you in accessing interpreter services through other programs. And the program is not responsible for costs associated with obtaining medical letters or assessment reports. I think this was mentioned in the previous slide. Yeah. Any addition, Hilda?
Nope. I think.
So how do we determine services? So those services needs to be assessed first. So they have to be determined prior to, eligibility must be determined prior to discussing service need. And then once eligibility is confirmed, an FSCD caseworker, usually it will be me, will assess using a family-centered service delivery model to discuss the child's disability and needs, the guardian's responsibilities, the cost-effective and appropriate services offered by FSCD. It will also discuss accessing other available supports and services first. We will also discuss coordinating and collaborating with other supports and services, including PUF, so that's the program unit funding, and the transition to adulthood planning. The family-centered service delivery reinforces the importance of viewing the family and child as an entire unit and respecting the values and cultural background and unique needs of each family. Thank you. Back to you, Hilda.
Thank you, Nelly. So yeah, as Nelly mentioned, a lot of the services is based on the assessed need, and each services usually has a regulation that must be followed. So it's usually a good conversation with your caseworker around your family's need, because we do know that every family is unique. And the expectation for services. So we understand that there are limited agency right now that's providing services on the reserve. And for example, I know Society Treatment of Autism is one of the agency that provides services right now on the reserve. And we are currently working on advocating to have more agencies so that we can provide more support and services later on. So expectation for services, we always want to involve parents in all service delivery, making sure that we are meeting families' priority. One thing that about our services is cannot be delivered in the school setting, just because we are under, there are different ministry, right, under the government of Alberta. School typically will get the education funding, whereas a lot of our services are mainly in the home or in the community. And we also want to make sure that services are approved in your family FSCD agreement or amendment before starting, just to really have that confirmation. Once the services are approved by FSCD, we will have that reimbursement process that we can guide families through in getting that reimbursement of the services. So as we mentioned, there are different type of services with FSCD, and I know one of the services that commonly requested a lot of times is around specialized services. I always say there's nothing special about specialized services. It is just really intended for families who have a child with severe disability and resulting in a critical service need that cannot be met by other programs or services. Specialized services is based on individual needs, and there is a team of clinicians that will provide strategies to parents and guardian around their child's activity of normal daily living. Another word, the definition around severe disability, what do we look at? It is resulting in a major loss of a child's functioning ability to engage in activity of normal daily living. So we typically look at how a child's routine looks like. Are there any kind of behavior? What is the communication social skill level of your child? And in this services, we do require the parents and the team to provide ongoing supervision and assistance and support that child might require in the home or in the community. So yeah, this is kind of the breakdown of what are some of the criteria for specialized services. Is that the child has to be eligible for FSCD, and we have identified the 2 or more of these critical areas where the child cannot be met through other available program and services, or in a less intrusive support and services. So areas that I've mentioned earlier is behavior, communication, social skill, cognitive ability, are there physical or motor development, or self-help and adaptive functioning. So those are kind of the areas that we looked at. Just want to make sure I covered everything here. Yeah. Okay. So this is kind of the good part around the resources, which Nellie will go through. And these are just some of the resources that we like to share with our families. So I'll let you go through that, Nellie.
And these resources will also be included in the electronic package that will be sent to you when, after the eligibility determination. So the first resource is the, of course, Human Services of Alberta document. So that's the ISP guideline. So ISP it stands for Individualized Service Plan for Specialized Services. So it will just it outlined what are the priorities, how to set goals, how to set objectives, the strategies, monitoring and tracking. So basically, how the service will meet your family's needs, your child and family's needs. And the second one is the guidelines for demonstrating effectiveness. So we need to make sure that we are addressing the child and disabilities and families' needs that is related to the disability. And then, so those are the links to the policy, procedures and regulation, and other resources. And I think I'm not sure if we have it here, but if we don't, maybe I can say Children's Link is also a good resource. So if you Google children'slink.ca, it will give you tons of resources available, although most of it could be based in Calgary, but right now we are hoping, some of these agencies will also come out to Siksika to provide services, and some of them are available online, especially right now when there is a pandemic. So I won't go through each of them. And the positive behavior supports for children, the pbsc.info. It can provide the terms, it can provide tip sheets, templates, again, the ISP, the individualized service plan, templates, and the manual. And, you know, if it can also give you information on how to address behaviors. So there are tip sheets there that might be helpful while, you know, waiting for services, and, you know, some of the strategies that you might use at home. Okay, yes. So Jordan's Principle is another resource, and it applies to all First Nations children, regardless of whether they live on or off reserve. It is not limited to children with disabilities, and under the Indigenous Services Canada policy, non-status children on reserve are being considered eligible for coverage under Jordan's Principle. It can help with a wide range of health, social, and educational needs, including the unique needs that First Nations, Two-Spirited, and LGBTQIA children and youth and those with disabilities may have. And that's the number for Jordan's Principle call center. And we just got this from the federal government website. So yeah. There's also the federal non-insured health benefit. You might all be familiar with this, the Jordan's Principle and the NIHB. It provides eligible First Nations and Inuit clients with coverage for a range of health benefits that are not covered through other social programs, private insurance plans, provincial or territorial health insurance. It provides coverage for vision care, dental care, mental health counseling, medical supplies and equipment prescription, and over-the-counter medications, medical transportation to access medically required health services that are not available on reserve or in the community of residents. And the email is there as well. We will make this available for them, right? But you can also go to the Canada.ca website and this information will be there. Regarding additional, I think we don't have it here, but the Alberta Aids for Daily Living also provides like mobility aids, you know, equipment that are disability related. So it's provided by the provincial government. So that's different than this NIHB, but it's also another resource that you can access. So just the difference between FSCD and the AADL, the Alberta Aids to Daily Living, FSCD provides services, AADL provides equipment and supplies. Yeah, thank you. Is that it? Oh, that's our office address and phone number. So feel free to call us if you have questions or connect with me. I think I have my email address there, maybe at the end of the slide. Yeah, 403-297-6022 is our main line.
Yeah, I don't think we have your email address on here, Nelly. So maybe we can share that on the chat box or with Pearl afterwards. The email address we have here is just the application, the new centralized application process email address if you're interested or thinking about applying for FSCD. And if you have any questions, like Nelly said, this is our main line that will connect you to the receptionist, and you can speak to, you know, they can direct you to the right person if you have any questions. Yeah, another support that we talked about earlier is the Alberta support. Right now there's not coming in just because of the COVID, but there is still available online or the call number just to access other Government of Alberta programs other than FSCD. So yeah. And
thank you, Nellie and Hilda, for that very informative session. As mentioned before, I'll put together all the resources in the email and send that out to people who request. My email is in the chat, or you can find it on the Siksika Health website. Stay tuned for the next Lunch and Learn series. It will be featuring a First Nations Health Consortium with Leon the Solway, who will speak more specifically to the Jordan's Principle services and support. We'll have the poster up running soon. I'll stop recording now and we'll take questions from anybody that may have questions for our presenters today. Thank you very much.